My name is Avery Roberts, and I work in outreach and engagement for Cure CMD. And I'm also here with Kelly Berger, who is the outreach and engagement coordinator for Cure CMD as well. We are very excited to be here with you all today because this is the first webinar that is launching our new Cure CMD webinar series. So we are very excited about that. So today in the back to school webinar, we are going to be featuring some updated info on navigating the new normal school year that is coming up or that has already started for some of you. This webinar will be recorded for on-demand viewing on our YouTube channel. So today we are going to be covering a lot of ground. We are going to discuss masks and safety and your protection. So like COVID vaccines, virtual versus in-person, mask wearing, etc. Managing stress, which is definitely huge in terms of transitions, getting through the year with a new normal, adapting to change and such. And then especially IEPs and 504s. So just accommodations, consensus building and knowing your rights are so important. IEPs and 504s can be tricky to interpret and know what's included and such. So our experts are here to tell you more about it, where to start, some tips and tricks, and more. So just a quick PSA, we will be utilizing the Zoom Q&A function during the webinar. We do have Q&A at the end of each speaker's talk and presentation. So you can save your questions until then, or you can start entering them into the Zoom Q&A portal at the bottom of your screen, and then we'll get to them soon. There is also the normal Zoom chat portal available, so please use that for say tech questions, programming, comments, etc. And then use the Q&A function for questions for the speakers and the webinar. We and staff will be monitoring both. So today we are joined by a group of amazing people. We have neuromuscular specialist and senior research physician, Dr. Foley, at the Neuromuscular and Neurogenetic Disorders of Childhood Section, National Institutes of Health, the NIH. We have Angela Maccarrone, who is a teaching staff classroom assistant at the Seattle Children's Alyssa Burnett Adult Life Center. She is also a clinical psychology PhD student at Seattle Pacific University and a CMD community member, being that she lives with Zeppin 1. We have Stephanie Olson, who is the lead therapist in the Crystal Lake School District 47 in the Chicago area, and she is also an IEP and 504 advisor. And then we have Sarah Foye, who is from Team Titan. She is an OT, a Titan family advocate and parent, being that her son has Titan-related myopathy, and she is also a CMDIR advisor. So at this point, I'm going to pass it over to Dr. Foley, who most of you probably know. She is going to give us her guidance and knowledge on getting back into the classroom and your child's protection. She's taken the time out of her busy schedule to be with us today. So thank you for being with us, Dr. Foley.
Thank you, Avery, for the kind introduction. I'm just going to share my slides here. Perfect. Well, thank you for the opportunity to speak. I've given a overview talk about thriving during the COVID-19 pandemic and remaining safe. And this is a follow-up talk really focused on returning back to school on a topic of masks and safety, as well as touching on other relevant topics so that we all continue to thrive and remain connected as we navigate the ongoing COVID-19 pandemic. So just to give a kind of a very brief overview, obviously all well known to all of you, but COVID-19 goes by a few names, also called SARS-CoV-2 or Severe Acute Respiratory Syndrome Coronavirus 2. It's important to just kind of emphasize that it spreads mainly via droplets or aerosols that are released when a person who is infected with COVID-19 coughs or sneezes or talks or sings. And it's much less commonly spread by touching an infected surface and then touching one's mouth, one's nose, or one's eyes. And we've all been hearing the news over the past months, different variants that were initially referred to where they were first identified. So we had heard about the UK variant, the South African variant, the Brazil variant, and then we heard about a variant that was found in India in October 2020, which is now known as the Delta variant. So now the naming is by Greek letters to help kind of clarify which variant is being referred to, as well as to not assign kind of blame towards the country where the variant was first found. The Delta variant, of course, is the one variant which is of great interest to us right now, because currently 93% of cases of COVID-19 in the US are estimated to be due to the Delta variant. And the preliminary data suggests that the Delta variant has greater infectiousness during early infection, making it more transmissible or more easily spread. And further preliminary data suggests that vaccinated individuals who have a breakthrough infection with the Delta variant can actually carry the same viral load or same amount of virus as unvaccinated individuals, and thus can also transmit the virus. So the CDC has come out with a new iteration of their mask wearing policy. Again, this one is from July 27th, and with added recommendations for fully vaccinated individuals to wear a mask in public indoor settings, quote unquote, in areas of substantial or high transmission. But the part that I kind of outlined in red here is what's most relevant to our patient population, is that even for fully vaccinated people, there is also really encouragement to wear a mask regardless of level of transmission, particularly if the individual themselves are at increased risk for severe disease, or if you live with someone at home who's at increased risk for severe disease, or who is not fully vaccinated. And so that's important to keep in mind, as well as the CDC has come out to recommend that universal indoor masking be in place for all teachers, staff, students, and visitors to school, regardless of vaccination status. The American Academy of Pediatrics has also come out and recommended universal mask wearing in school, mainly because many children are not yet eligible for vaccination, as well as difficulty in really knowing who's vaccinated at what time, and mask wearing being the most effective means of preventing transmission of the virus. So just to kind of highlight, wearing a mask is so essential. It's very effective, especially if it's fitting correctly. So you want the mask to fit right and to be comfortable. And there are different size masks. And this is kind of a little demonstration by the World Health Organization of the key parts of the mask fit. And so it should be no gaps at the nose. And so many masks have actually a bendable nose piece to help ensure that it's a snug enough fit. There should be no gaps at the sides of the mask. So if the mask is too large, there may be gaps there, and there shouldn't be gaps there because respiratory droplets can escape there, as well as other droplets from the environment can get in. And there should be no gaps around the chin. So wearing a mask is essential, and wearing a mask which fits and hopefully also is one that is comfortable is key. COVID-19 vaccination obviously is highly protective against severe illness and hospitalizations. We've been hearing this, for the past months. And it's important to recognize that vaccinating everyone in the family as soon as eligible will lower the risk of the child being infected at home, but also will protect family members if the child brings the virus home from school. So vaccination remains the most effective means of protection against severe illness with COVID-19, as well as controlling the spread of COVID-19. So there are different vaccines. I'm just going to briefly summarize the situation as it is current right now. And the mRNA vaccines, there are two of them. So and they both are based off of the mRNA, or the protein, the spike protein of COVID-19. One's made by Moderna, one's made by Pfizer. And in the largest study of both the mRNA vaccines in 500,000 healthcare workers, there's approximately 94% efficacy in prevention of symptomatic illness after both doses. So each of the mRNA vaccines are given in 2 separate doses, 4 weeks between the doses for the Moderna vaccine and 3 weeks between doses of the Pfizer vaccine. And it's important to recognize that the mRNA vaccine does not affect the DNA of your cells. It is actually a protein which gets injected to the muscle, which causes an immune response, which helps the body to remain protected against the COVID-19 virus. In terms of eligibility for the vaccine for children less than 12 years, which is many of our patient population, there had been a phase 1 open label trial of the Pfizer mRNA vaccine in children 5 to 12 years of age, which was a dose finding study. That was 144 children looking at 3 separate doses, a 10 microgram, 20 microgram, and 30 micrograms. From that data from the phase 1 study, a phase 2/3 placebo-controlled trial has been started with the doses which were selected from the phase 1 trial. And so currently for children ages 5 to 11 years, the clinical trial is using 10 micrograms, and for children 6 months to 3 years of age, the dose is 3 micrograms. So you can see there was really a dose de-escalation down from the dose used for those 12 years of age and older. So the dose used in 12 years of age and older is 30 micrograms, and the one that's being tried for children is 10 micrograms for 5 to 11 years and 3 micrograms for 6 months to 5 years. And that is a large study of 4,500 children at 101 sites internationally. And I included down here the clinical trials identification number in case you're interested in that study. And just to kind of reiterate, it is a placebo-controlled trial, so you don't know if you will receive the vaccine or the placebo. The vaccines which are already available for those 12 years of age and older is the mRNA vaccine by Pfizer, and there are vaccines that are approved for ages 18 years and older, and that is the Moderna mRNA vaccine and Johnson & Johnson's adenovirus vaccine. And just very briefly for the observed side effects for the mRNA-based vaccine, because most of our population will be receiving the mRNA vaccines, most common side effects will be pain, redness, and swelling at the site of the injection, and then some flu-like symptoms in the rest of your body. And that typically occurs within 7 days of vaccination and lasts between 1 to 3 days. And most people report having more symptoms after the second dose of the mRNA vaccine. And how it works, again, just briefly, is that it's injected into the muscle. There's the mRNA from the cell delivers instructions to make the spike protein, and that's kind of in your body for about 24 hours. Your cells make the spike protein, then your immune system causes a systemic immune response, causes those flu-like symptoms, but also results in your body recognizing the mRNA spike protein of the virus as foreign. So if you're exposed to the virus, you will not have severe disease. And then briefly, just to contrast, the adenovirus vaccines are made by a non-replicating adenovirus, and that is both the Johnson & Johnson vaccine and the Oxford vaccine made by AstraZeneca. And the Johnson & Johnson vaccine is a single dose, and the Oxford AstraZeneca vaccine is 2 doses, 12 weeks apart. Very importantly for our population, some news articles have incorrectly abbreviated adenovirus as AAV. It's very important to know that none of the currently available COVID-19 vaccines use an adeno-associated virus, or AAV, and none of the available vaccines will result in producing antibodies against AAVs. And so if such AAV vaccines become available in the future, which are not available now, their use in individuals who may be candidates for AAV-based gene therapy may be contraindicated. But at the current time, there are no vaccines based on AAV, so no concern about antibodies against AAV, and then thus not being eligible for future gene therapy studies. And then just briefly to reiterate that the AAP, the American Academy of Pediatrics, has recommended vaccination for all children when approved by the FDA under emergency use authorization. So returning back to school, so the main question, which is so difficult for, I'm sure, for so many of you, is this virtual versus in-person attendance. And I think that only some schools now will continue to offer a virtual option. So the decision whether or not to return to the classroom is complicated, and it's based on many factors, including an individual's clinical status, the precautions taken by the school or the lack of precautions, and the level of COVID-19 cases in your particular area. And it's important to reiterate to your local school that individuals with congenital muscle disease should be considered vulnerable to or at high risk for complications from infection with COVID-19. So that should be important consideration that your school recognizes. So as back to school planning is in progress, there are some things that the school should be planning for, and namely for masks and social distancing. So masks help to protect others, but they also help to protect the mask wearer. So both. And that's why mask wearing is so essential, and then probably the best way to prevent transmission of COVID-19 in the school setting. Mask breaks outdoors should be allowed because it is a long time to expect a child to be wearing a mask, and having the opportunity to go outside, take the mask off for a few deep breaths is very important and helpful. Mask rules will vary between schools, even though the American Academy of Pediatrics and the Centers for Disease Control have given guidelines that all schools should have mask mandates in place. Social distancing should be enforced and allowed, kind of allowances made in the classroom for 3 feet between children in elementary school and 3 to 6 weeks apart for children in middle school and high school. I just wanted to kind of share with you, the New York Times has a coronavirus briefing column that they've been running, and they did actually address this question of what should parents do if their school district doesn't have a mask policy. It's important that the school district recognizes that the CDC has really estimated that mask mandates are associated with a 20% reduction of COVID-19 incidents in schools, and that parents who have children in school districts without mask mandates should learn what other steps are being taken, including regular testing and ventilation measures. But taken together, the most effective means for decreasing transmission in the school setting really is universal mask wearing. There was a large study which just recently published in the Lancet Child Adolescent Health that came out of the UK of looking at the incidence of COVID-19 infection among school-age children. The study was over 258,000 children. It started from last March 2020 through February of this year, and it found that only 0.7% of children tested positive for COVID-19, with the median duration of symptoms of 7 days for older children and 5 for younger children, and the most common symptoms being fatigue and headache. And the study kind of highlighted that most typically children have a mild course, but it's so important to recall that children who are more vulnerable to the COVID-19 infection may have a more severe course of infection with COVID-19. There are also regional considerations. There are some resources out there looking at that, and some studies that have looked at going back to school reopening, and COVID-19 hospitalization in the area. And so the CDC found that in-person learning, there was no effect if the COVID-19 hospitalization rates in the base in the surrounding county were low or moderate. Returning to school did not affect COVID-19 transmission or incidents. And so basically it's necessary to think about what's going on locally. The current time, there really is high to substantial transmission of the Delta variant, actually in all states. And so it's a difficult period, and that will also affect decision-making about returning to in-person school. There are some resources. This one actually comes from the American Academy of Pediatrics and the Children's Hospital Association. It's data that's given weekly, and there's some limitations in the data. For example, you'll see there's no data here from Texas, but most states will give weekly data on hospitalizations. And that's helpful to get a sense of what's going on in your community. And this is data from the end of last week showing the percent increase per state, and you can see Louisiana has over 9% increase in hospitalizations in pediatric hospitals. I wanted to also highlight the essentialness of continued proactive pulmonary care. We have a Cure CMD pulmonary care guideline. We also have a wonderful pulmonary web series that Kiera Sunris and Sophie Kim put together, available via the Cure CMD YouTube page. But it's important to understand that along with COVID-19, there is also increased activity of respiratory syncytial virus right now. That's normally a winter virus, but because of quarantining and mask wearing, we're really seeing an upswing of beyond COVID-19 other respiratory viruses. So it's essential to have consistent use of non-invasive ventilation and BiPAP with assessment of settings, and also readjustment of your BiPAP settings by your local pulmonary team, whether that be in the clinic with the pulmonary team or with the repeat sleep study, but making sure that you have optimized pulmonary status is going to be really helpful as a proactive means of maintaining a good pulmonary health. Also, daily use of the cough assist machine to promote lung and chest wall expansion when you're well, or very frequent use up to every hour on the insufflation exsufflation mode if you have symptoms of a respiratory infection. So I would say daily use morning and night on the insufflation mode to help promote good pulmonary health, and then any symptoms of respiratory infection up to every hour insufflation exsufflation mode to bring up any phlegm, cough up any phlegm that may be in your upper respiratory tract before it goes down to your lower respiratory tract and settles into your lungs. And then influenza vaccination, other regularly scheduled vaccines are also really important not to miss, because we are seeing also rhinovirus, other respiratory infections that had not been active coming back significantly now, and that's also affecting pediatric hospitalizations at this time. And then just to kind of give one more plug for vitamin D, most of you are taking vitamin D anyway for bone health. In children, it's 600 to 1,000 IUs, international units per day. Adults between 1,000 to 2,000 IUs per day. But beyond just being essential for bone health, it also has an extraordinarily important role for immune function. And so there have been associations that those with good vitamin D levels are less vulnerable to severe infection with COVID-19. And so continue to take daily vitamin D, very important for the immune system. And then finally, briefly to mention, anyone who tests positive for COVID-19, you're eligible for monoclonal antibodies. Anyone 12 years of age or older, there's remdesivir, and that's for those who are hospitalized with COVID-19. And there's also, for those that are not yet hospitalized but test positive for COVID-19, there are 2 combination monoclonal antibodies available and have been found to be quite effective when given, administered early on into the COVID-19 infection. One of you in the community asked me the question about the effectiveness of the monoclonal antibodies against the Delta variant. It's an extraordinarily good question. Monoclonal antibodies are still effective against Delta variant, maybe not as effective as against the other variants, but still quite effective. And so if you test positive for COVID-19, your local hospital has the monoclonal antibodies available. And it's really those who are at high risk for progressing to severe COVID-19, which would be all of our congenital muscle disease individuals. And so do request that, and it is quite effective. And then finally, I just wanted to say, sharing knowledge and staying connected helps the congenital muscle disease community stay safe and thrive during the ongoing pandemic. And I can't say enough for the resource you are for each other, as well as giving us questions, excellent questions, and staying connected really will keep us all safe and keep us thriving as we go through the ongoing pandemic. Thank you very much.
Dr. Foley, can you quickly cover what the standard of care is for an infected child under the age of 12?
Yes, that's a great question. So under the age of 12, unfortunately, the monoclonal antibodies are not approved for that, but the standard of care would be really very proactive respiratory care. So the COPPAS is every hour, and then really a low threshold to go to your local pediatric hospital for observation because of the situation right now with the co-occurrence of the respiratory syncytial virus and the COVID-19, having that extra layer of observation and support as needed would be very helpful. But I think if there are minimal symptoms and using the COPPAS system frequently at home, and you're able also to kind of sense that things are stable, staying at home is probably okay. But I think keeping a very low threshold to go into your local hospital would be really an excellent idea.
Great, thank you.
All right, well, thank you so much, Dr. Foley. That was super helpful and informative in terms of returning to the classroom and making that tricky decision. So we are going to have a Q&A with Dr. Foley soon, but first we are actually going to watch a clip from Cure CMD's KSSK CMD Chats, episode 2, Respiratory Natural History, that Dr. Foley did mention. In the episode, Dr. Meyer and Dr. Sanani talk about what people affected by CMD can do when wearing masks in public spaces. So feel free to start putting your questions into the Q&A portal while we're reviewing the clip. If you have not watched the past KSSK Pulmonary Series episodes yet, I highly suggest you do. You can access them on the Cure CMD YouTube channel.
While we're in the midst of a global pandemic, masks are currently required in public spaces. So for people like Kira and I with CMD, wearing masks makes it hard to breathe. What do you advise as doctors?
It's just one more form of one hurdle that the bug has to overcome to get to you. The other thing is that it's a constant reminder not to touch your face. And if anything, that's the bigger benefit, I think, that comes from wearing a mask, is that really it's a deterrent or a constant reminder not to lift your hands to touch your nose. There are certain masks that are certainly more comfortable than others, and I think it's important to find that. Find the one that fits you more comfortably, because if you are prone to having to readjust it repeatedly, you are bringing your hands to your face.
Yeah.
I think the little bit of discomfort that we get from a little bit of warmth behind it is a small price to pay for the difficulty you could experience if you get sick.
Yeah, that is true.
Masks suck, but COVID sucks more.
Yeah.
So my recommendation is to make it a style statement and find one that looks nice to you, that fits well, and get used to wearing it. Let's say you're in school and or out in public somewhere and you've been wearing your mask straight for an hour and it's uncomfortable. take a moment and go away from everybody, go in the corner, sanitize your hands, and then take your mask off. You can itch your nose, you could scratch your cheek, and then put your mask back on and then go about your business. It's okay to take breaks. But it's critically important that if you're out in public and around other people, outside of your family, that you wear a mask.
All right, well, now Callie will walk us through Dr. Foley's Q&A.
All right, Dr. Foye, our first question, what should we do for our children besides having them wear a mask? In school districts where mask wearing is not required and the Delta variant is running rampant, and children are not eligible for the vaccine yet. They're too young.
Yeah, it's a great question. I think that it's a very personalized decision whether to return to school. Without the clear option in many school districts of having the virtual option, it's quite complicated. And so I think returning to school in a district where there's not a mask mandate is difficult. So if your child's wearing a mask but all the other children aren't, your child is somewhat protected, but not as protected as they would be if all the children were wearing masks. And so I think it's a delicate situation at present to figure out if returning to the classroom would be okay if there's not a mask mandate being enforced in your local school district. But beyond mask wearing, I think that kind of carefully avoiding situations of indoor gatherings that are a lot of people that are maybe not wearing masks, or any large indoor gathering, because there's going to be a high level of transmission, given that maybe poor ventilation and a lot of people in one place. Outdoor gatherings are fine, but again, wearing masks even in large outdoor gatherings is also still very important. Even though it's outdoors, if a lot of people together that are not standing at least 3 feet apart, there's still a risk of transmission. So it's still a delicate time. I mean, there's a hope that the vaccines for the children less than 12 years of age will be approved in the upcoming months, but the timeline's uncertain. So they need to kind of ensure they have the doses they're trying are absolutely safe. And so I think it is a delicate time. And so I think continued mask wearing and social distancing precautions and avoiding large gatherings is the best way forward. Whether or not avoiding returning to this classroom until the Delta variant situation maybe lessens in terms of transmission and rates locally, that's a difficult question because some of you have asked me that as well. So I think if your school does not enforce mask wearing, it's more of a complex scenario at the present time. So it's not unfortunately not a really clear way forward. I think it's kind of your personal comfort, your child's clinical condition, the school's level of preparedness for return to school, and also the level of transmission locally all play a role.
Okay, great. Our next question is, if we received our vaccination 6 months ago, should we be concerned if the efficacy has gone down after 6 months?
That's a great question. So far the data that the FDA is looking at carefully is the data in immunocompromised individuals who didn't have a very good, perhaps, immune response to the initial even 2-dose mRNA vaccines. Those are the individuals that I believe, as of yesterday, it would be the ones that would be considered first for boosters. As far as we know from our congenital muscle disease population, the immune response to the vaccines, in particular the mRNA vaccines, should be sufficient. Whether or not in general a population will have a decreased immune response over time is still being evaluated. And so I think we know that up to 6 months there's good efficacy, but after that point in time there may be a need for a booster shot. And I think that's still an ongoing discussion that's not yet come to a conclusion about that. But we do expect that individuals that are not immunocompromised should have a good immune response to the vaccines after being fully vaccinated.
Okay, and our next question, are you aware of any of studies exploring the effect of the Delta variant on vaccinated kids or adults with neuromuscular diseases?
Great question. Not neuromuscular diseases. They're looking a lot. So most of the data is coming out. I mean, the one silver lining I have to say from the COVID-19 pandemic is a lot of the data has been shared immediately. So most data coming out are preprints. So papers of research that are not yet in a peer-reviewed, approved journal, but yet are posted online so all can see. And so I'm part of a lot of these groups that are looking at the data in real time. So the data in real time shows that the vaccine efficacy against the Delta variant may be a little bit less than against the other variants, however, still quite effective against severe disease and hospitalization. And so in neuromuscular conditions, I mean, I think if you are vaccinated, fully vaccinated and not immunocompromised, we would believe you'd fall within the group of those that still have good efficacy, even against the Delta variant. Although I can't say there's been a focus study of neuromuscular affected individuals with the Delta variant who are fully vaccinated. But the general thought is that there's still good protection.
Is the NIH doing trials for children under 12 for the COVID-19 vaccine?
Great question. So we are not, but Children's National Medical Center in downtown DC is participating in that study. I can put in the chat, there's a link to all the 101 sites where they are actively enrolling patients. There's also the Center for Immunization Research Inpatient Unit in Baltimore is also a site. So we are not, but there are many sites across the US that are enrolling for that study.
So now we are going to hear from Angela Maccarrone, who is going to touch on how to manage stress through tricky times. We all know that our emotions have been all over the place this pandemic, so hopefully Angela can help you remain calm right now. Take it away, Angela.
Thank you, Avery. Okay, so yes, hello everyone. My name's Angela Maccarrone. Avery had a lovely introduction already, but this is just a little bit about me. I'm currently a PhD student studying clinical psychology, and my eventual goal is to specialize in rehabilitation psychology, so working with individuals with chronic illness and disability. And that's largely based on my own experiences as someone with CMD. So I was officially diagnosed with SEPN1, or also known as lean-on CMD, back in 2011 when I was 17. So I just want to say, like, I'm here with all of you. Like, I'm in this with all of you, with your concerns, with the pandemic going on. And I'm hoping that given my background and my education and training so far, that I'm able to kind of give some guidance and support. I do want to give a caveat though, like, I am not a licensed practicing mental health clinician currently. I'm still in school. I do have education and training and background, and I am an affected individual, but just please keep that in mind. I'm not a licensed mental health professional yet, but I soon will be. And I also work at Seattle Children's Alyssa Burnett Adult Life Center, which provides services for adults with autism and intellectual disabilities. So I have a passion for working with people with physical disabilities, such as myself, but also I really love working with others with more intellectual and cognitive disabilities as well. All right, so another caveat I want to give, it's impossible to go into depth and understand everything there is to know about anxiety and mental health in a very short presentation. So this is going to be very broad, but I'm hoping it can be effective and helpful for all of you. Also, this presentation, it'll be broad, so I'm hoping that everything that I go over can be applied to both kids and adults as well. So parents and adults, individuals with CMD, hopefully this can be helpful, but I also added a couple pieces that are more targeted to kids, since this is our back to school webinar. The first thing that I wanted to go over is understanding anxiety. With the pandemic going on, obviously anxiety there's a lot to be anxious about, right? Understandably so. But I think the first piece of it is naming it to taming it. I think if we are able to put a name to the things and the thoughts and emotions that we're experiencing, they have less control over us and they have less power over us. And so I think when we have a lot going on and we're very overwhelmed, it's important to identify your thoughts and emotions. Really take a step back. What's going on here? What am I experiencing? And I think when you're working with kids, something that I like to use is a emotions. You can't really see it with my background, but it's a little emotions vocabulary chart. So just like going through like, oh, am I feeling scared right now? Am I feeling anxious right now? Am I feeling angry? Am I feeling happy? Am I feeling sleepy? So just really going through and like understanding what exactly is going on here. Another thing that I think is important to go over is identify your triggers. Like, what is actually causing this? What is the root cause of my anxiety or my worry right now? It's also important to understand the ways that anxiety can affect us. It can be very physical, so heart palpitations, shallow breathing, an increase in body temperature, muscle tension. It can be more behavioral, especially in children. So acting out, maybe a little bit more like aggression, or it could be more mental. It could be excessive worry or ruminating thoughts, for example. Or it can be a combination of all three that are affecting each other. It'll be different for different people as well. So understanding the way that anxiety affects you and your kids is really important. And then another piece of the puzzle that I think is important to go over is asking ourselves, okay, so I understand my emotion. I figured out the trigger. I know how anxiety is affecting me, but now can I try to challenge those anxious thoughts that I'm having? Oftentimes we think of the worst case scenario and then our mind races, and that's where that anxiety comes in. But can you sit back and say, okay, is this going to matter a week from now? Is this going to matter a month or a year from now? And you might say, well, yeah, actually, this will matter. And maybe you can't challenge those anxious thoughts. Maybe they are, a very real threat to you. And given everything going on right now with the pandemic, you might be saying, okay, yeah, all of my worries about my child going back to school right now, those are real. And I have a valid concern of these threats that I'm worried about. And so in that moment, I think it's okay to realize, like, yeah, like this is real. This is what's going on. And at that point, that kind of leads us to, okay, well, this is the situation. I have a lot of anxiety and worry about it. So now, how am I going to adapt to that change? And there's a couple things that can be helpful to remember. And this can also be applied for kids too. So for kids who are experiencing anxiety, for example, I think it's really important to be supportive and give attention. There's a lot going on right now, and your child might, understandably so, be very worried. They, just like you as parents, that have your own worries about going back to school, your kids are probably worried too. So I think just being supportive and giving that attention, and understanding where they're coming from is really important. Something else that I think is helpful is providing facts. I think it's important to not shy away from these discussions and having kids understand what COVID is, and understanding the ways that it can impact them, especially for kids with CMD. I think, they probably, they know what's going on. They understand their own health and medical concerns. And so I think just providing facts in an age appropriate way is really essential. The more people have facts and knowledge, the less scary things are. And so I think just giving them the facts that, hey, here's what's going on in the world right now with COVID, and helping them just kind of understand it. Something else that can be helpful when adapting to change in our new normal is establishing a routine. I know a lot of you have probably already tried to do this with staying at home and quarantine and homeschooling, but really just trying to create as much consistency and a schedule as possible. So waking up at the same time that you normally would for a school day, having breaks and meals and lunch scheduled in, breaking it up like you would for like school sessions. So every 30 or 40 minutes, breaking up into a new activity. That can be very helpful as well. The fourth thing that is helpful is creating healthy habits. And I put a little star next to that because I want to come back to that in a minute. But just doing your best to have, adequate nutrition, sleep, fresh air, exercise in whatever way exercise looks for you or your child, PT, OT, those sorts of things. And then also staying connected to other people, and knowing that you're not alone is so essential in navigating this pandemic world that we're all going through. So I said that I wanted to go back to the healthy habits piece of it. Something that I find really helpful in working with clients is going over coping mechanisms. So what are the ways that we can cope when we have overwhelming feelings of anxiety or depression or just worry? And so I think talking with your kids about, okay, what are the ways that we can, help you deal with all of these really overwhelming emotions? And something I like to do is a coping card activity. And so you can make this as simple or as detailed as possible. And if you just Google coping card template, you can actually find quite a bit of like pre-made templates that you can print off, or just ideas or art projects for a coping card. But basically what a coping card is just, it's like a little card. You can have a piece of paper or an index card, for example, and you write down ways that you can cool off or cope or manage your emotions when you are feeling escalated. And so personally, I like to put more than just coping mechanisms, like take a deep breath, go outside, call a friend, that sort of thing. Those are all helpful, but I also like to put down on the coping card triggers. So that way the individual or child knows, okay, these are the things that make me more anxious than normal. And so that they're aware and they can recognize that in themselves. And then in addition to triggers, I also like to put on the coping card a list of ways that anxiety affects me. So if you know that for you or your child, you get, you might shut down, for example, and you get really quiet and you isolate, then you would write that down on the coping card. Like, okay, when I kind of shut down and isolate myself, that's a way that I know that I'm not doing so great. So triggers, your warning signs, and then also, like I said, the coping mechanisms. So is it going outside for a walk? Is it calling a friend? Is it doing deep breathing? Is it drinking some water? Is it listening to music? Putting all of those things down that will help you kind of get yourself more regulated is really effective. That way, when you are getting escalated, or you feel yourself, getting really overwhelmed about something, you can go to that card and look at it without trying to think about it. And it's less overwhelming that way. I mentioned finding support is a really helpful way to adapting to change in the new normal. And I just want to reiterate, like, you are not alone. There's a lot going on, like I've mentioned many times. There's a lot of worry, a lot of unknowns, a lot of anxiety, but you don't have to go through this alone. And the great thing is that Cure CMD has amazing supports. Personally, I've been really fortunate to connect with others on our Step in One Facebook group, which has been really helpful to navigate this pandemic with all of our questions, and just kind of reminding myself that I'm not alone in this, and maybe I might have peers who don't have CMD and they don't understand my worries of having CMD in a pandemic. But I also have friends and other peers with CMD, and specifically Step in One, that do understand where I'm coming from and kind of help normalize my fears a little bit. So I would really encourage that. And then just another little tip for the coping card. If you do this activity with your kids, help your kids identify who they can turn to, who are the supports in their life that to help them remember that they aren't alone. And you can also put this on the coping card as well. And also just a description on this picture. This was from the CMD conference a couple years ago in 2017. These are very dear friends of mine, the Manleys, Maddie and Luke Manley, who I met through Facebook on our Step in One page, and they've become wonderful dear friends. Okay, you might be wondering, when is it time to receive professional help? And there is no one answer to this question. Obviously, it's going to look very different for different people. But I will say, though, that a sign that you might want to consider professional help is when you're kind of at a point, or you see for your kids, they're at a point where they're not able to like cope or perform their duties. So like if they're struggling in school, or you're struggling at work, or in your social relationships, every depression, what have you, if that's getting in the way of you enjoying your time and your life, and all of those ways that you're able to cope, like coping mechanisms, those aren't enough, then it might be time to consider professional help, which can be really helpful for some people. But again, it's going to look different for everyone. So there really is no one answer to that. And then I just wanted to provide my contact information with all of you. I really love connecting with other people. If you have any questions about what it's like to transition from a teen to a young adult with CMD, or college, or professional journeys, anything like that, I'm happy to connect with all of you. And then the last thing that I wanted to end with is that there's a lot of people who are struggling right now, given our world with the pandemic. And so if that applies to any of you, I really encourage you to reach out and seek support. So I have a couple of hotlines, the crisis text line that you can text 24/7. There's also a suicide prevention hotline here, and then also a specific teen suicide hotline here as well. And I encourage you, please reach out if you are feeling overwhelmed and you're in crisis, because there's lots of amazing, wonderful people out there who want to help you and, want you to live your best life. So that concludes everything that I have for all of you. And I hope this was helpful. Thank you.
Okay, yeah, Angela, our first question is, what kind of resources might be available via the school district for managing stress?
Yeah, so that is a super good question. I think my answer for that would be to check in with your local schools, like school counselor. I think they're going to have the best resources that are specialized for that school and school district. I wish I had a better answer for that, but check in with your school counselor. That would be the biggest thing.
All right, thank you so much, Angela. If you guys have questions for her, just put them in the Q&A function, and we are going to move on to Stephanie and Sarah. They are going to talk about where to start and what's included in IEPs and 504s, some tips and tricks, what's included legally or required legally to ensure inclusion, knowing your rights, and how to advocate for your needs. The floor is yours, ladies.
So I'm Stephanie Olson. I'm an occupational therapist. I live in Crystal Lake, Illinois, and I am Sarah's sister. So we kind of work together a little bit to present this information to you about school systems. I have worked in a school system for the last 31 years. So that's my experience. The first thing I want to talk about is to make parents aware that the federal government did not reduce the requirements for special education services. And so they are still held to all of the requirements to follow a free and appropriate public education, which is referred to as FAPE. And I wanted to let you know that's making it, it's been very, very challenging for school districts. So on the one side, we still have to follow all the requirements, yet we still need to modify everything because of COVID and being able to follow precautions. And so I can tell you as a therapist who worked last year in person, hybrid, and remotely, it felt like I was standing on shifting sand. And as soon as our district worked together and got a plan and we thought everything was going well, something would change. Or in our area, the numbers went up really high and we had to change things. And so it was hard. Teachers are planners. School districts like to have a plan. They like to follow the plan and assess the plan. And last year that was really difficult to do. And so hopefully everyone understands. I believe most school districts are doing the best they can do. So just to review the basics, to understand that students with disabilities should have the access to school environments, educational programs with peers, extracurricular programs with peers. Now, a lot of those have been canceled during COVID. Effective curriculum and instruction, support services when needed, so like OT, PT, and speech. And also, there's some new regulations regarding school meals that those still need to be provided. None of that changed, even with the modifications that are being done due to COVID. And I put this slide in while the others were talking. And so this was kind of, I needed a visual reminder for myself. We are really in a state of creative problem solving. I think in school systems, we're very used to routines and relying on things, and everybody needs to get creative, whether it's teachers, parents, the students being able to become engaged also. Some of the things that popped in my head while others were speaking, just in my building, they do, we have pool noodles that are 6 feet. They had to take one pool noodle and then take a second pool noodle, cut it, measure it to be 6 feet. They taped them together, and every single classroom has one of those. And so I know the distancing now is 3 feet, but I can tell you as someone who's in the building, you frequently think, oh, I'm 3 feet away from a person, but we literally have pool noodles that we carry around with us. And it's so helpful to have that visual. So in regards to the question of what can I do with schools, I don't know if a school would be willing to have something like that. You'd be amazed at how more effective we are at social distancing when you have a visual. Another comment that came to my mind is please parents provide extra masks at school because sometimes things happen to them. As a therapist in the schools, it's amazing how many students I don't think ever wash their masks. I think we have kids who wore the same mask over and over. They had food stains on them for weeks. And so please make sure those are extras are there. Another thing is we in my district do collect data on mask wearing or something else. So like, let's say your child might either not be able to wear a mask or needs a break. As a parent, you can say, can I please have data collected? I want to know what time was the break and how long was it? And please collect that and provide that to me at the end of the week. And so you can monitor with your child, like, oh, she only got a half-hour break today and she had a headache when she came home or something else. So data collection is something you can ask for as a parent. Another thing that's been really essential for us is when you have an IEP, you have to follow the laws and the guidelines. So for instance, to make a change to an IEP, you'd have to notify parents. Parents legally should have so many days. You have to change the paperwork. The paperwork has to go through the system. And so what we did is adopted, asked parents to agree to kind of what we call a learning plan. And a learning plan was something we could change very quickly, and we didn't have to go through all the regulations with an IEP. So the IEP was still in place, but we attached these learning plans where we modified them frequently regarding masks or changes or different things that we needed to do. So that's where that creative problem solving and that flexibility comes into play. Real quick slide for you just to understand that there's federal guidelines. The federal guidelines are then interpreted by the states, and then each school district then interprets what the state declared. And so I just want parents to be aware of what you read on social media from one state may not be necessarily true from another state. Yes, the overall general federal guidelines need to be followed, but some states have these minor difficulties. So just be aware of that. It's great when you're connecting with people across the country, but just keep that in the back of your mind. Just wanted to say this, that in terms of accommodations, in working with students with disabilities in the school setting, schools are required to make reasonable accommodations to allow a student to participate in services, programs, and activities, and to ensure that they're not discriminated. And so an accommodation is considered reasonable so long as it does not fundamentally alter the nature of the goods, service, facility, privilege, advantage, or accommodation being offered. So this is information to let you know what accommodations you can ask for. If it does fundamentally alter something, then it may not be possible, and the school district does have the right to say that's not something we can do. But there are a lot of accommodations that should be put into place for students with disabilities. I just wanted to say that number one, as a parent, I would recommend rereading your student's IEP or 504. If it could have been written many months ago, and just review it. And then, yes, all staff should be reading IEPs and 504s, but some therapists or some teachers have dozens of students on their caseload, and they may not remember everything that's on the IEP. For instance, it's not uncommon for an occupational therapist to have 70 to 100 students on their caseload. You can send a friendly reminder to the team. And I'm not talking your case manager should know your child in and out, and your classroom's teacher should know your child in and out. But if you have extended staff, or maybe your students in middle school and they're going to multiple teachers, and just a little reminder, like maybe you need equipment cleaned. So once a month you could say like, hey, it's so-and-so's mom. I just want to remind you, I don't want them on any equipment or touching anything until it's disinfected. Or please remember these are the guidelines, or please remember this is in the IEP. And so when it's written in a nice manner, that's nice for therapists to have that kind of reminder. Very quickly, I'm going to skip through this. If anyone wanted to review, there's resources out there about the differences between 504s and IEPs. For parents, ask questions until you understand the process. It's so easy when you work in a school system for year after year after year to forget that the person sitting across from the table from you doesn't understand the process. So please ask questions. Know your timelines, know your rights. If you make a request, get it in writing. Even if you get a phone call from somebody, maybe you talk to your case manager and they say, oh yeah, we'll put the mask on. Follow up with an email and saying, thanks for talking to me. today, Saturday, August, whatever it is, 6th or 7th, per our conversation, I just want to review, this is what we talked about. Over and over and over, I can tell you, get it in writing and get it in writing. I'm gonna just be aware if you have an IEP meeting to see who's being invited to that IEP meeting, and being aware that you do have rights, that the whole IEP team meeting needs to be there unless you do an excusal to allow them not to be there. There's my note again, get it in writing. So in the IEP, there should be a note section. So if you have a phone call, you can follow up with an email to get it in writing. If you have a meeting with your team, you can have it in the notes. Anything they're talking about, please get it written in the notes. Because if it's not in the notes, they are not required to implement it. There's some information you can find out when you're asking questions about homebound services to find out what your district would be willing to do. Some districts are going to be more flexible than others, and some may have different rules than others. Tips to follow. If you're on this webinar, you're already kind of doing this. You're looking to become an active follower of updates from the CDC, your regional, your district level. You can go to board meetings. And I already talked about that. I felt like every time we worked something out, something would shift and then there'd be bugs again. And so it was a very challenging time. There are different ways to go about if you have a dispute with your team. So if you have an IEP dispute, there you can have an informal negotiation, you can go to mediation, you can go to due process, civil lawsuit, a state complaint, or you could go to the Office of Civil Rights, OCR. If your student has a 504, it's a little bit different process, but there's a lot of steps before going to due process with an IEP. But parents, be aware of your rights and know what you have to do in order to implement those rights. If you're in disagreement with your school district, if emotions get high in a meeting, I have been in many meetings where the staff have heightened emotions, the parents have heightened emotions, and I really wish more often we would just take a break. We just heard about a lot of coping mechanisms and things you can do to help manage your emotions and calm down. And if anybody on the team, and I mean parents or staff, can't speak constructively or politely, just take a break and just say, we need 5 minutes, move your body, go walk around, and be able to do that. There are a number of parent resources that I think Sarah and Rachel are going to make this information available to you afterwards. Sarah, you are up.
Thank you, Stephanie. I'm very proud of my big sister. So I'm Sarah, and I am a parent of a young child with a rare muscle disease. And he graduated from high school and has transitioned successfully to college. And I'm also an occupational therapist with school-based experience, and everything I ever learned was from my big sister, Stephanie. So she's a great resource. And by the way, Stephanie has offered herself as a consultant to the community to reach out to her if you have questions. You can email, I think they can put it in the chat, info@curecmd.org, or just check the chat. If you have specific questions, Stephanie often make herself available for that. I wanted to talk a little bit off topic from COVID related topic and more about just general working with the school district. Is sometimes if you look, most parents are looking out to do the best and get the greatest services and supports for their child. But like Stephanie mentioned, and just keep in mind that the framework for the school district is they're actually mandated to provide an appropriate public education, not the best. And sometimes, not always, but sometimes this can be a recipe for conflict if you have different perspectives or points of view where you're coming from. So just one tip, you probably already know this, but just keep in mind is that your relationship with your school team can be a very long one. In the meantime, just remember that your relationship with your school district can go all the way from preschool to age 18 or even 21 if you decide to stay in the school system up to age 21. So this long-term relationship is worth developing patterns of good communication. Stephanie touched on a lot of tips in this area, acknowledgements and thank yous, following up with communication in writing, and other tips, which I'm going to get to next. So just keep that in mind. Stephanie talked a little bit about conflicts and taking breaks if you are in a meeting and there's some stress going on. And also our other speaker talked about kind of coping strategies. You could actually have this little card in front of you if you were in a meeting or on a call and you found yourself getting kind of tensions escalating, is you could use some of these words, which could be work to building consensus, which is, I would like the team to consider X. Would the team be willing to change Y? Could we please discuss this item further? Also wondering what kind of data were used in the decision-making process. You could start with areas where you agree with. Well, I agree with you on this, this, and this. However, I want us to think more about this together. The other thing is starting from goals, like my goal for my child is this. And you can even think about long-term goals, and thinking about goals, both from the school staff and also from the parents' family side, is a really good way to build consensus. The other thing is that sometimes these meetings can be overwhelming. Maybe you're sitting in a room with 8 professionals who just gave you formal reports in language that's hard to understand. You can say to them, you know what, this is a lot of information. Can we just hold off on finalizing this IEP so I have some time to think about the information that was shared? It's another strategy. The other thing is, if you're coming down to writing up a report for an IEP, you could say, I agree with having this IEP in this manner, but I'd like to request another meeting in an X amount of time to see how it's working. And on that note, I just remind you that an IEP is what I consider like a living document, is that it's subject to change. And like Stephanie just described, as we can imagine in this COVID environment, things are changing all the time. So just something else to talk about. And we've talked a lot about teams, and just like your medical team and medical care for people with congenital muscle disease, the education takes place on a team. And so not team members may not always be on the same page at the same time. And so these are just a couple of tips about how you build agreement within the team. And first of all, keeping in mind that education takes place in the context of this entire team. Also starts at the very basic level of the student. And I'll give you one example is I could spend a lot of time and effort thinking about a plan to take my child out of gym and talking behind the scenes with my husband and school team members, et cetera, only to find out that that would really upset my son, that was his favorite class in school. So when you're looking at consensus building, starting with the student and then moving out, what does the family agree on? Having parents on the same page so that when you're going into a meeting, that you have an agreement starting at that basic unit and then building out from there. You can even have parents breaking down rules in order to achieve desired outcomes. So for example, my husband was the one doing a lot of the research on the laws and regulations and then building out from there. So the other thing is by the way, the other thing about starting with the student is that if a student is able to identify and understand needs and express them, it's the building blocks of advocacy. Because as education expands, and like my son is in college now, as they get to the college level, they need to advocate for themselves. And so even starting at the very youngest level, being able to identify their needs and explain it to this large team of people. So let's see, moving on to the next slide, which, okay, you got it. Not only do students have homework, but parents have homework to also. So educating yourself on the rules for your state. And this I have, every IEP meeting that I went to in our school district, they were mandated at the time to provide this booklet, which is Parents' Rights in Special Education. Now, this is old, and my guess is that they probably do that electronically now, and there may be a document like this available for your state, and it can vary by state. And the other thing that we had was this, which is the booklet, and you can see our notes and sticky notes too, which is the administrative code for the special education law for the state of New Jersey. The other thing that I would add to that, which is going to be happening during this pandemic period, is that each state is going to have a plan regarding the rules for reopening the schools in your state. And it can start with CDC guidelines and recommendations, and then it varies by state, like Dr. Foley was talking about. And so that is also another item that you would want to educate yourself on during this pandemic period. Also, part of your homework is, you know that you can ask to review IEP documents in advance of a meeting, so you're not taken by surprise. The rules on that vary by state. So Stephanie and I's states actually have different guidelines on that. So different teams might provide advanced information at different time frames. One of the things I always like to do, if I was worried about how things might go going into a meeting, was try to like put out a feeler and find out where is the team at on these different aspects of things that I might be worried about. And so you could do that by an email or a phone call or a pick up and drop off, kind of getting a feeler out in advance. So for example, sometimes I would go to my case manager and say, should we expect any big changes at this upcoming IMP meeting, or we pretty much, status quo? And you would find during transition periods, like transitioning from preschool to kindergarten, or from one grade school to a middle school, and middle school to high school, would kind of be those big opportunities for possible big changes. The other thing is people don't always think about this, but we always considered classmates and other parents part of our team. And so ever since kindergarten, my son wrote a letter to his classmates about his situation and his needs. And we wrote a letter to parents about what the situation are, just so we were super transparent, very open. And it gave people, armed people with information that they could feel open, and also became part of our team. Like, hey, if your child is sick and wants to play with our son, that's something we're going to put on hold because of his concerns, even with the common cold. And sometimes when parents understand that, they are part of the classroom team in a new way for your child. The last thing I thought of while I was listening to the other speakers today was, I'm a parent, I've been in your shoes, and all of us facing children with chronic illnesses, we have a lot of decisions to make all the time, and information will be changing. But two of the things that we found over the years that really helped us was, number one, set a date for when we're going to decide about something. Like if you're a person who's trying to decide what kind of learning experience or environment you're going to have come when school starts, set a date by which your family is going to decide. And the reason I'm saying that is because at some point, like that worry could be present every day. And if I had thoughts or resources, I could put them into a Google Doc and drop them in there and then try to forget about them and say, yeah, that's an important decision and it's looming. And you know what? I'm not going to decide that today. And it's not something I have to worry about today. And so if you have a date by which you and your family are going to make choices or decisions about your school learning situation, especially with the pandemic, that can be helpful. And the other thing we did is I use Google Docs because then we could all three of us share. I mean, this is obviously young children are not going on Google Docs, or maybe they are now, I don't know. But we would actually write it down like a table. Here's the pluses and here's the minuses of our decision-making process. So the last thing I wanted to say is that this is a challenging time with lots of decisions and questions going on, but having come out on the other side is that we've been recently looking through photographs from grade school experience, and just to cherish these school days. They're special, can be joyous, and that just please try to remember the fun of childhood and the grade school experience or school experience. And every little achievement is a victory, and to make sure to celebrate those. So thank you. I really love all the speakers today. Thank you.
I'm just going to jump back in for 1 second and say something about Sarah talking about explaining, letting the other kids in the class know, and then letting the other parents know how important it is for the other students to have that explanation. It makes it so much easier. And when an adult puts it out there, like, sure, you can ask about this ventilator, or yes, you can ask about how the wheelchair works like this. It just opens things up so much more for the students in the classroom to get more involved and get interested. And then they don't question it. They want a little explanation and then they're done. And one example I'll give is parents whose child were in kindergarten, he was in a wheelchair. They were so nervous. They wanted to come and explain to the classroom about their son. He was not in the class at the time. Parents were saying, I'm so nervous, what's going to happen? They're never going to accept my child. They came in, they talked a little bit about the wheelchair and why, and then they finish and say, any questions? And a little kindergarten girl raised her hand and said, I got a cat yesterday. And the parents afterwards talked about this huge sense of relief that they thought all the kids wanted was just a connection with their child, and the kindergarten students had moved on to their new kitten, and it wasn't a big deal to them anymore. And what a success. That child had 5 years of success in our building. So a great point on that, Sarah.
I wish you all a safe and healthy school year.
All right, well, thank you everyone so much for being here today. A very big thank you to our speakers as well. Stay tuned for more info on our next webinar because this is a webinar series. If you have any questions about the webinar or just about any other Cure CMD programming, please don't hesitate to reach out. Contact us at outreach@curecmd.org. It's on the screen. I and our team would be more than happy to answer any questions, including for our speakers that we had today. So we definitely want to keep the conversation going. So share with us what you learned on social media. Be sure to tag us at CureCMD as our universal handle, and make sure to also use the hashtag CMD back to school when posting. If you already don't follow us on social media, our socials and handles are on the screen. So make sure to go check those out. We cannot wait to see your posts. We recently actually did a week-long social media challenge. So if you follow us, you can be up to date on stuff like that. So yeah, well, thank you everyone so much again, and we hope to see you soon. Have a great day, everyone.